The World Health Organization says more diseases are emerging as a result of the COVID-19 pandemic impact on healthcare services around the world. Today on the program, we are taking a look at all you need to know about monkeypox and Lassa fever. In Nigeria, over 172 cases have been reported for monkeypox, while Lassa fever is also reporting new cases. Stay with us, the conversation begins after this break. It is still Sound Health on Lagos Television. I am Olasumbo Modupe. Joining us via Zoom this evening is Dr. Yahya Disu Head Communications, Nigerian Center for Disease Control and Prevention. He's going to share his expertise on how to prevent monkeypox and Lassa fever. Good evening, Dr. Disu, and thanks for joining us.
Good evening, Sumbo. Thank you for having me.
All right, Dr. Disu, can you quickly bring us up to speed with updates on monkeypox in the country?
Well, we are all aware of monkeypox occurrence globally as well as in Nigeria. And it's a fact that Nigeria has been reporting monkeypox sporadically since 2017. But this year, we have recorded numbers that have really dwarfed what we recorded in 2017 when we first experienced its reemergence. And we've reported a large number of confirmed cases and in more than 26 states of the Federation. And then we have seen new states that have never reported monkeypox before that are now reporting monkeypox cases. There is increase in awareness to this disease because of the global trend and also investment in surveillance and creating awareness in the community in Nigeria for people to be able to report when they see signs and symptoms. And then government has also made efforts to increase surveillance, that is reporting early and notifying early through training of disease notification officers in the local governments, and then as well as improving our diagnostic capacity. That is, we have a national reference laboratory where this can be confirmed. Once samples are taken in the state, are sent to the laboratory, and we have turnaround time of 24 hours to respond.
All right, Dr. Disu, why is there a sudden surge of cases of monkeypox in the country? Because we are still in the pandemic era, but we're also seeing more surges in terms of monkeypox.
I just mentioned the reason for this is one, there is improvement or investment in surveillance system and diagnostic capacity in the country, and this will be attributable to recent pandemic of COVID-19, lessons and legacies from COVID-19, and then generally awareness about infectious diseases in the community. People know where to report and also what to report. We are still not there We still have a long way to go, but it looks as if there is some progress. Another major reason is the global awareness of this monkeypox. Occurring in many countries of the world, and it's a global village. And what happens in one country, and with social media, people will get to know what is happening around the world in any country. And then with the increasing number of countries across the world are having this, we're also being more conscious in our own country as well.
All right, is this explanation applicable to Lassa fever as well?
The two of them are zoonotic diseases. When I say zoonotic diseases, they are both transmitted from animals and then to humans. And then, funny enough, rodents have been implicated for both diseases. So it could be due to our lifestyle of interaction with animals, environmental hygiene, and then so if they share common mode of transmission, common source, then we also expect corresponding increase in those two cases. But the same reason for Lassa that we have attributed to monkeypox is also for Lassa fever. The legacies of COVID-19 with regards to awareness about infectious diseases reporting and knowing where to report, and can also actually explain why we are having increase in the number of cases in Lassa fever. But funny enough, we are still having increase in cases in states that are known to be endemic for this disease. States that have been reporting this before, like Ondo State, Edo State, and now Bauchi is also coming up and contributing the large number of cases to the national data. So investments in diagnostic capacity is also improving for Lassa fever. We now have more laboratories in other states of the Federation that can confirm this diagnosis. So bringing this services closer to the people. So that can actually also be accountable or responsible for increasing number of cases that we are having. Training of our DSNOs, disease surveillance and notification officers in the LGAs, who also ensure that they sensitize healthcare workers in facilities for them to report this when community people present them in the health facilities.
All right, Dr. Disu, thank you so much for that explanation. Tell us, what symptoms must we look out for now, and who are at risk of contacting or contracting these two diseases, monkeypox and Lassa fever?
There are symptoms that are common to both of them, and there are symptoms that are specific to each disease. For common symptoms, they all present with fever, headache, general body weakness, sometimes sore throat, and so on. And those things you see in somebody who is having malaria, fever generally. But for Lassa fever, from the name, very hemorrhagic fever, and you have symptoms that could lead to bleeding from the different parts of the body, and especially in the late stage of the presentation. So this is specific for Lassa fever. But most people don't get to that stage. But once somebody gets to that stage, that means the person is likely to die, especially if the person does not present in the hospital on time. For monkeypox, it is basically lesion that is just like we have rashes for other diseases like chicken pox, measles, and so on. But for monkeypox, it's also a rash illness. The symptoms are specific. The rash is specific for monkeypox. It looks like it is an elevated lesion that's usually spread across the body and starts from the face and then spread downwards. And then you see it more on the palms and soles of the feet. And then you can also see it on the trunk. And then it comes in stages. Initially, it will be like a flat lesion, then it becomes raised, and then it fills up with fluid, and then can become clot, and then later this bursts, and then we start exudating the content. So it ends up with clot, which is later removed. So you can see this on different parts of the body, and that's what you usually see in monkeypox. It may be similar to chickenpox, but the lesion for chickenpox is more on the surface than monkeypox, which is more deeper. But the clinicians who are trained will be able to distinguish the two. But the important thing is for people to present in facilities to report this.
Before we take a look at precautionary measures against these diseases, are they treatable? What are the chances of survival when contracted or if contracted?
Generally, the guideline for management of diseases is to reduce mortality, death from the disease. In a situation where these diseases are inevitable, you cannot totally prevent them. But our goal is to make sure that people don't die from them. So treatment is relative anyway, and there are some ailments that you have complete cure for, and there are some ailments that you still don't have cure for, but there is research to determine what drugs will eventually give us a complete cure for them. So Lassa fever and monkeypox belong to that category that are still being researched because they are viral illness. But the good thing about monkeypox is the self-limiting disease as against Lassa fever that is not self-limiting. If you don't do anything about this, somebody eventually going to die from Lassa fever. But for monkeypox, it's self-limiting. Most cases recover and on their own, except those who have immunocompromised condition, that is, who have low level of immunity or who are on certain medications that suppress their immunity or who have some diseases. We call them comorbidities. For instance, if somebody has a disease that suppresses your immunity, a chronic illness, it may limit the possibility of surviving the disease. So those are the good thing about monkeypox is it is self-limiting, and then most people who suffer this disease recover on their own. But for Lassa fever, it is not self-limiting. That for those who manifest the symptoms for Lassa fever, if nothing is done to reverse the condition, the person is likely going to die from it. However, there are a number of cases who may be asymptomatic in with Lassa fever infection, and they are not showing symptoms. And the danger in this is they continue to spread it to people who may be vulnerable, who are our loved ones. And that's why we all need to observe the precautions to prevent transmission, to even protect us from getting these diseases in the first place, whether we are going to die from it or not, because we don't know who may be victims of this, and they are likely to be our friends, our loved ones, colleagues in the office, and so on and so forth.
Okay, let's hear more of the precautionary measures now. Measures to take against the further spread, let's say amongst family members, workplace settings, and the hospital health facilities.
I would like to categorize this for simplicity case. First thing you need to do is, if you don't even get this disease, reduce the risk of getting this disease. That is, if you know people who are ill and they are in your vicinity, help them to report in health facility early, because the longer they stay in your vicinity, the higher the chances that they can spread it to their loved ones. And then we're not saying we should reject them, but we should care for them to ensure that they receive appropriate care early so that they stop transmitting this. The higher you remove the threat from your environment, the better for everyone. And the second thing is we should observe personal and environmental hygiene. Hand hygiene is very critical. Inadvertent transmission can still occur, maybe through contamination of surfaces that we all share or items that we all share. But if we wash our hands regularly and we clean our environment, we are likely going to reduce the risk of transmission of this disease. And then also for Lassa fever specifically, and we need to observe safe food handling. The way it's transmitted from rodents through contamination of our foods, and then when humans ingest those food, they are more likely to get it. Or in the process of preparing infected rodents, and then the fluids from the rodents contaminate you, and then you have to scratch your body, and you can get it. So what we need to do is rodent control for Lassa fever. Block all holes in our homes to prevent rodents from coming into our homes, and then also to ensure that we keep our food source containers that are not accessible to rodents, And then we should be very careful when we see dead rodents, the way we handle them. We handle them in such a way that we don't contaminate ourselves, because we don't know why they die and what killed them. Cleaning our rooms, our houses is also very helpful, because these rodents urinate everywhere. And then this Lassa fever virus is usually found in these rodents' urine. The rodents are infected. So generally speaking, those are things that we need to observe. If we are entering the season, we know bush burning by farmers can also drive more rodents from the forest into our vicinity. So we need to discourage this. We need to work with stakeholders in the agri sector to find a way of managing the bush we have cleared in such a way that they don't become hazardous to our environment. Then environmental hygiene in terms of waste management, because we don't want to create a breeding site for rodents. We need to ensure that waste are safely removed from the environment and they are taken care of so that they don't attract rodents to our environment. So, of course, we need to share this knowledge with our loved ones, our friends. The more people know about this, the more likely they're going to take precautions to prevent this transmission. For monkeypox, close contact with somebody who is infected has been linked to transmission. So what we need to do is, when we see somebody who has rash illness, we also encourage them to seek care in a facility, and then to also ensure that people observe hygiene, personal hygiene, hand hygiene, just like I said for Lassa fever, and then in case you touch contaminated surfaces, or so that you don't use that to infect yourselves. So for our loved ones that have this, we encourage them to go to the hospital early, and if at all we want to take care of them, we use protective devices like gloves to make sure that we don't contaminate ourselves, and we safely dispose those gloves. That is even before they are taken to the hospitals. And so I think that those are things that we need to do generally to prevent this transmission. Because the area we report, the health authorities are able to confirm what the issue is and institute mechanism for preventing further transmission in our communities, as well as helping those affected to recover early and go back to their daily routines.
All right. Are there vaccines available for the prevention of monkeypox and Lassa fever?
Right now for Lassa fever, there is no vaccine, but there are efforts, initiatives to develop vaccines. So we have vaccine candidates that are now on trial, and we hope and we'll get results that would help us to commence use of this vaccine. Thanks to CEPI, that's a coalition for epidemic preparedness innovation, and that is working in collaboration with the Nigerian Lassa Fever Consortium to develop this vaccine. And then, so we hope if these vaccines are available, we encourage Nigerians, particularly people who are high risk, who are eligible for these vaccines, to take these vaccines. So that's, but for monkeypox, yes, WHO has approved smallpox vaccine for use, but then this is still available in limited in quantities. So there are negotiations ongoing to ensure that there is equitable access to this vaccine, whether within countries and within countries. So we hope once we have this stock, and then we'll be able to access it and then utilize it to curb the control of this disease.
Dr. Disu, is there a link between COVID-19 vaccination and the current monkeypox outbreak? There are myths and misconceptions. We don't know if there are myths and misconceptions truly that we see online. Is there actually a link between monkeypox and the ongoing COVID-19 vaccinations?
There is no link between COVID-19 vaccination and emergence of monkeypox transmission globally now. There is no link. It's just a coincidence. And then possibly because there is some awareness about diseases due to COVID-19 pandemic, and we're now beginning to see other diseases, and then we're now reporting them about. It's not linked to effect of vaccination for COVID-19. It's just a misconception which we all need to fight to protect our health.
All right, for viewers at home that are still doubting the pandemic, is the pandemic over just because we are reporting limited number of cases?
It's not over until it is over. Let me take us back to how this started. It started in one country and in one city. And before you know it, it becomes a problem for the whole country and then the continent as well as the rest of the world until we're able to eliminate the virus. We'll continue to have the threat. But good progress has been made in terms of control, in terms of what you do to prevent or limit transmission. Unlike 2-3 years ago, we had no idea of what to do because the science has not really understood how this virus behave. Now we have a vaccine that can limit the severity of this infection in those who are affected. And the benefit of this vaccine to the society is when a significant number, that is a critical mass of the society, get the vaccines, that is when we can be sure that the risk of transmission of this disease can be minimized completely. Now, the reality is the COVID-19 virus is with us. What happens to us about COVID-19 is determined largely by what we do. The earlier we embrace this reality and understand its factors that drive its transmission, its severity, and embrace the recommended actions by the public health authorities, the better for us as a society. The more we deny, the more this transmission go underground. And you know, it's a virus infection. It can easily develop mutation and that can be more deadly to us, that can shock us in an unexpected way. And the way we can control this is adhere strictly to those recommended measures, non-pharmaceutical interventions, hand hygiene, physical distancing, use of face masks, and then use taking the vaccine, which is a magic bullet that will eventually see the elimination of COVID-19 pandemic in our society.
It is not over until it's over. Let's embrace public health advisories, especially non-pharmaceutical measures to curb COVID-19 and other emerging diseases. Dr. Yahya Disu Head Communications, Nigerian Center for Disease Control and Prevention. Thank you so much for your time on Sound Health today. We appreciate you.
Thank you for having me. Before I go, people must test to ensure that they know their status when they have symptoms for COVID-19. Okay. It is only when they are tested they will know whether this is COVID-19 or malaria. So it's also part of the efforts to tackle the pandemic.
Right. Bye. Thank you so much, Dr. Disu. We really appreciate your time once again. Sound Health continues with trending health report from around the world. Please stay tuned. Well, this is where we say thank you on today's episode of Sound Health. Remember, COVID-19 is real as well as other diseases out there. Protect yourself and your loved ones. There is no link between COVID-19 vaccination and the current outbreak of monkeypox or Lassa fever. Get vaccinated. Adhere strictly to all precautionary measures. For comments and inquiries, please send SMS to 0035 826603 or follow us on social media at LTV Social #SoundHealth. A sound health is a sound mind. Make healthy living your choice.